Hi, my name is Tim Long. I am the Administrative Clinical Director for New Life Medical Center, and today I'm going to talk to you about primary care and what makes us different from other primary care facilities. The biggest complaint we hear from our clients or patients when they convert over and we start using this for primary care, the reason they've left their current primary care physician or provider is because, basically 4 reasons. One is they feel like they're a number. They feel like, and 2, they don't feel like they get the attention they need or deserve so that the doctor can understand what's really going on in their life. They feel like they're just being pushed through the system and they're just another number, get in and get out as fast as possible. Another thing is they feel like that anything the insurance doesn't cover, they're just getting charged outrageous prices and fees for. And another one, probably another big complaint and I personally have experienced this too, is you schedule an appointment for 8 o'clock, but they don't see you till 9 o'clock, 9:15, 9:30. So you're sitting there waiting for 45 minutes to an hour and a half just to get in and see after you had your appointment scheduled. So, and that's enough to upset anybody, so I understand. I've been through that myself. But let me play devil's advocate for just a minute, because I can tell you firsthand, doctors, I've talked to a lot of them, just kind of interviewing them. They don't want to be that way. They want to see their patient. They want to spend time with the patient. But what's happening in healthcare is that most of these clinics, and more and more every day, are being bought out by larger groups or hospitals. And they're being bought out for a lot of reasons. One, costs go up, just the stress and things go along with running a medical clinic. And the doctors just can't handle everything. So they sell out to the larger groups. So what happens when you become part of that larger group, you do just become a number, because at that point, quotas are being usually put on doctors and even the nurses and right down to the medical assistants. They have to see so many patients a day. You can only spend so much time with them, or you get penalized or get flagged. And so what happens, they're going to spend 7 or 8 minutes with you and they have to move on to the next one. And it's all about money for the bigger companies. I understand it too, because that's what they're in. They're big businesses. They're to make money. But the person suffering is you. And I can say the doctors are suffering a little bit too, because they're becoming almost like they're in a factory. They're not able to build that relationship with the patient anymore. So that's what's happening in this industry. The clinics are being bought out by the big companies and hospitals, and they're being put under quotas, and they have to hit a certain number of patients, and it's just it's all about the money. Well, what makes us different? Well, one of the things that makes us different is we're locally owned, and we're owned by a big group, so we determine the policies of the clinic here at this clinic. So there is no quotas on our providers. In fact, it's the opposite. They're told, even in the interview, you have to be a people person and you have to build a relationship with these patients. That's what they want, and that's what they need. And you are not a number here. So that's one of the big differences. And if you even go see our reviews, you're going to see we're the cheers of medical clinics. We've won Best of Medical Clinic 2015, 16, 17, 18, 19. We love our patients, and we want to take care of them, and we treat them like we want to be treated. And some of the things we do for our patients, besides just the attention that they get from us, it's one that we started opening a little bit early. Now we open at 7:30 to let patients get in before they go on their way to work. And we stay open till 5:30 so that they can maybe catch us on the way home. So we're open 10 hours a day, Monday through Friday, and we even opened up on Saturdays from 9 to 1 to give people a chance that couldn't come by the week to come see us on Saturday. Another thing that is different between us and a lot of clinics is our wait times are either none or very, very short. And the reason for that is, even if we get hung up with the patient, it's taking longer than expected, we have plenty of staff on site to start taking care of that patient. So our wait times are short, anywhere from no wait time to 6 or 7 minutes. A lot of times, as soon as you hand us paperwork, we pull you straight back because we have the staff on site. We would rather be slightly overstaffed than understaffed, because being understaffed stresses the staff and it stresses the patients, and we don't want either one of those. When you get back into the room, you're going to get all the attention you need from the medical assistants, the nurses, and the physicians. We're not going to rush them out. We've had patients they spent 30 minutes with. We want to build that relationship because we got to understand your life, your lifestyle, so we can help you with your health care. Another thing is we don't nickel and dime you to death. We are not going to charge you $95 for a CBC. I know that's another big complaint we hear is it's a lab we charge $9 for it, that they're getting billed $75 and $95 for. We've seen it. We've even called and got it corrected and went to bat for them to get that eliminated. So we will not nickel and dime you to death here. If you don't have insurance, the vast majority of our patients do have insurance, but if you don't, we have very reasonable prices. We're going to do what's right. We're going to take care of you. We're constantly looking on GoodRx for our medications. We're cheaper than GoodRx. We call around for our competitors, and we're always a little bit lower priced than our competitors. So, but we're not going to sacrifice the service. This is a service business. We're going to take good care of your health care, but we also have to take good care of the relationship. So if you are looking for a primary care facility, provider, give us a call, come by and give us a try. We promise to take good care of you.